Okay, good afternoon, everyone. We're going to go ahead and get started. We think some folks are still going to be logging on. My name is Amanda. I'm going to be moderating today before we kick things off to Ted Hart, who is President and CEO of Krafft America. Just some housekeeping rules. So everyone should be muted. I've muted people. Please keep your videos off too. I believe I've hid some as well. That just keeps the bandwidth clear for everyone and keeps things running efficiently. We're also recording the session and we'll be sharing out to everyone who registered before. So be on the lookout for that following this webinar this afternoon. Please also look at the chat box at the bottom of your screen. Please use that for questions. We're planning to go through the presentation and then move on to questions afterwards. So we're trying to keep everything to about 45 minutes, just so you're aware of timing and what to expect. And with that, I will turn things over to Ted Hart. Ted, make sure that you are unmuted.
Call connected. I am connected.
Okay, Ted, I think we've got you now.
All right, terrific. I am here. Thank you, everyone. We can go to the next slide, please. "192 countries around the world are already affected by the coronavirus global pandemic, many in dramatic and heart-wrenching ways. Many layers of the COVID-19 crisis are unfolding in front of our eyes. On the front lines are charities providing direct relief on the ground where it is needed most, and right alongside them are the philanthropic donors, foundations, and corporations who support them. Last week, from March 24th through the 26th, Krafft America surveyed regulatory compliant eligible charities around the world. The results we will share with you today represent 544 charities in 93 countries on 6 continents. Today, they collectively share their stories. These charities who provide the fabric to the global social safety net. Our report, The Voice of Charities Facing COVID-19 Worldwide, will be released at krafftamerica.org immediately following this webinar. And to all of our registered guests today, we will email you a copy of this groundbreaking report. A special thank you to our Vice President of Thought Leadership, Kinga Ela, team members Joseph Walker, Yair Kohenka, and Ron Crognelli, and many others at Krafft America who literally burned the midnight oil to crunch the numbers and bring this important data to life. In the eye of the storm, as infection and death rates continue to soar around the world, we bring you this webinar. Today, I will be joined by Krafft America's Senior Vice President of External Affairs, Jessie Krafft. Jessie is on the front lines herself, working directly with some of the country's largest philanthropists and corporations. She and her team are connecting these contributors to charities Krafft America has validated, charities that must meet our 100-point validation protocol before they can be added to a list of eligible charities, a designation much trusted by donors throughout this country. Thank you for joining us today as we provide authentic insights into the current state of nonprofits around the world in the face of COVID-19, as they give us an idea of what the future may bring for them and how philanthropy can make the difference. As we all work to mobilize funding around the planet and right here in the United States at an unprecedented rate. Together, with tens of thousands of Krafft America approved charities, they are catalyzing the impact of community response. Jessie, let's get started. Next slide. So as I shared with you, this survey was completed by Krafft America. In this survey, we will be covering the immediate impact of the global pandemic on operations, financial security and stability, how organizations are adapting their strategy, and how organizations are responding. Next slide. 544 organizations in 93 countries. This slide shows you where those countries are on the planet. You can see that this survey provides a very broad view of global nonprofit life today. Next slide, please. We wanted to provide you with a breakdown of the regional landscape of the charities that responded to our survey. And when you receive these slides, you will also see an asterisk there with Russia and Central Asia. Our sister office, Krafft Russia, has also created a report of how COVID-19 is changing the work of Russian NGOs, and we will provide you a link to that survey as well. You can see very broad global response here. Next slide. These are the types of charities, the work that is done by charities, and the scope of their work that are represented in this report. You'll see that the largest number of charities that are part of this report are providing healthcare. There are hospitals, medical services, they're providing direct service to patients. And then as you read down through, you can see the wide variety of charities that are provided and their field of focus as organizations. Next slide, please. Jessie, we're going to ask you to come and help us with some of this analysis. There are most of the charities in this report are affected by one level of restriction or another that have been placed on them by government. Give us your view of the data before us. You have Jessie off mute.
Can you hear me now?
We can hear you now. So Jessie, go ahead.
Okay, great. Sorry about that.
We may have lost the connection here. Let me know if Jessie.
Can you hear me now?
I can hear you now. Go ahead, Jessie.
Okay,
sorry, everyone.
I have to have it unmuted in two places. As you can see, the immediate impact just from this first figure shown on this slide has been significant. The majority of respondents to the survey said that 94.84% have said that they have specific restrictions related to coronavirus that have had an immediate impact on their organizations. So, you know, this is something that is widespread, obviously, and a global phenomenon, even in countries that have had, you know, to date, fortunately, lower rates. There are already restrictions on their activities and things that are affecting the work that they're doing.
And Jessie, as we get into this report, what I think is significant about this slide is that even charities that are not currently under government restrictions are being negatively impacted by the global pandemic, that rate being slightly larger. Next slide. We asked, do respondent organizations expect to be impacted negatively by the coronavirus pandemic in the coming year? This slide shares with you, for those charities that answered no to are they currently being affected by the pandemic, this is what charities are telling us in terms of when they expect to be affected by the coronavirus global pandemic. We have a quote here from one of the charities that says, "We will negatively be affected by the coronavirus for the foreseeable future. Even when the crisis subsides, we will not be able to pick up where we left off." Jessie, I know you're working directly, you and your team are working directly with charities. Bring this data to life for us. What are they experiencing?
Yeah, of course. So this data right here is an ever-moving target and is something that we're going to have to monitor closely over the next several months. But this represents the best guess that charities have right now on the effects and the timelines of the effects that the coronavirus could have on their organizations. But one of the overall messages of this report in the narrative responses, because we did collect a lot of rich information as well in the narrative that that different organizations contributed. But the overall message there was that there's an incredible amount of uncertainty in regard to this long-term impact. And even when restrictions are lifted and we feel that there's enough safety to go out and be in public and be in community spaces once again, that there's uncertainty in terms of how long it will take for example, for parents to feel comfortable sending children to school, and for the public to feel comfortable participating in public and community events and fundraisers and things like that. So I think that we're looking at a situation where even when the government mandated restrictions are lifted, this could have a long-term impact on the public's willingness to engage in different community events, and that was the message in the narrative responses, was just that yes, of course we're affected now in many ways, but we're really uncertain in terms of the long term and how and when we will be able to continue our activities.
Terrific. Next slide, please. Which areas of our respondent organizations are being impacted most by the coronavirus global pandemic? You can see in this slide that there are high levels of responses in all sorts of different areas. And I think, Jessie, one of the messages that we take away from this, and again from the very rich narrative data that Charities shared with us, is that as they're trying to continue to run their organizations, and as we saw, only 10 respondents said they don't expect to have any effect at all. Their entire world is changing as nonprofit organizations, many of which started as this pandemic already started with being a bit under-resourced. Help us understand what all of this combined is meaning to nonprofit organizations.
Yeah, I have a lot of comments on this area. I think one of the biggest messages we've been hearing from organizations right now is that aside from the obvious, events and service cancellations that are happening right now, one of the biggest and most immediate concerns for many of these organizations is the cancellation of major fundraising events. Some organizations rely on 1 to 2 major galas or different events each year, a walk or a run or something of that sort. And many of those occur during the spring and the summertime. And some of those activities represent their funding for the majority of their year of operations. And all of those events have been canceled. And so additionally, there are many other charities that operate through funding that comes from, the sales at thrift shops or charity shops, as they call them in Europe, or through different storefronts, such as, the Habitat for Humanity Restore program, and all of these have been closed. So I think, in this 67% of organizations that are responding saying that contributions have already been reduced, it's because they've had to close these stores and cancel these events and things like that. And they're really uncertain as to how they're going to fill these gaps in their funding. And it's just placing a lot of doubt on the organizations, their ability to operate at all in the coming year. So we're seeing a lot of fear and uncertainty with these organizations right now. And really a message that, we've been sharing with our charity partners is that, many of them need to shift the way they speak to and approach their supporters, to be more creative about and to ask for funding through different means and different mechanisms if they've had to cancel different events like this, which is of course a challenge for organizations that have relied on a certain method of fundraising for a long time. And at the same time, I think the other challenge is that organizations are recognizing that they need to be sensitive in how they approach donors, because many of their donors are likely now facing financial hardship or through this economic downturn and reductions in pay and job losses and things like that. So they might not have the capability themselves personally anymore of providing funding that they would have had in prior years. We hosted a webinar yesterday with a few of our corporate partners, and one of our partners, which is Edwards Life Sciences, Christine Fontana, mentioned that one thing that they're doing as a corporation is that they're accelerating their normal grant programs to fund charities that they would have funded later in the year, to fund them now, just to make sure they feel supported and they know that Edwards Life Sciences is not stepping out of the picture in terms of their, in terms of the support that they would have offered them otherwise. And so I think that's a great response from donors, is to say, hey, we're still here from you. We're still moving forward with our planned activities and with the grants that you rely on every year. And just in terms of what we're telling donors, I think that's a good way to respond if you're able to respond in that way, to make sure that charities know they can still rely on you because there is so much uncertainty, that maybe you can alleviate that to some extent.
Yeah, very well. Again, let's just summarize this page, as Jessie has shared with us, is that there's a lot of disruption for charities, for their staff, for their funding streams. There's never a good time for something this global and this catastrophic to happen, but certainly for this to happen, as Jessie mentioned, right in the middle of the sort of spring fundraising time in the Northern Hemisphere and the fall fundraising time in the Southern Hemisphere, has really disrupted the funding sources for a lot of charities. Let's go to the next slide. I will also just share with folks that there's a question in the group chat, how many charities were surveyed. 1,600 charities received the survey, 544 responded. We also heard from a number of charities who wanted to participate after we had to close the survey so that the data could be reviewed for this report. I will also share with the group that Krafft America is making the commitment that we will resurvey this group and we will reissue this report as a regular update throughout the coronavirus pandemic, so that we can continue as we are today to monitor sort of the pulse of nonprofit organizations. Jessie, we had a question here that we asked, are the organizations able to work remotely? And this is a mixed bag, but certainly I made really focused in on the fact that even those who are able to work remotely, the largest percentage here in this report had to report that they had already had to suspend some of their client-facing programs, which of course can be detrimental to those clients. So Jessie, again, what are you hearing, and what is your team hearing directly from charities?
Yeah, so I think it's fortunate that we're seeing such a high percentage are able to work remotely. I hate to think what this would have looked like had this happened 10 years ago. So I think we're fortunate in that, but as Ted mentioned, even where they are able to work remotely, there are many that are still having to suspend some of their operations. And I think, this becomes a bigger challenge and will become a bigger challenge in countries that experience greater connection difficulties or do not have the ability to remote access from their homes. I think that everyone that's responding that they are working remotely, I think is very fortunate that they have the means and that technology, but we are certainly going to see, I would say, increased responses as this proceeds from organizations that just absolutely don't have that capability. There are many service providers, such as food banks. We work with many food banks, and some of them responded to this, that are considered essential services and are remaining open, which really means that, so many of these charity employees and volunteers are taking daily risks to their personal health to maintain their services. And it means that even though they're not medical responders, of course, they still need funding and personal protective equipment to protect those that are providing these essential services, and really should be considered among those that are responding to COVID-19 relief. So, because we are seeing, of course, organizations that are still operating because they're considered essential, and they might not be seen as providing direct COVID-19 relief, but in fact, their activities and the way that they've had to shift those activities has created a funding gap where they also need additional funding to protect their employees and to continue those really necessary services.
That's right. Jessie, the 9.91% of those that responded here have already had to close their operations and to suspend their work. And of course, our fear is that without continued and proper funding of charities of all sorts, we will see that number go up in future renditions of this. We're just going to go to the next slide. I know you had some additional thoughts here, Jessie, but we have a couple of quotes here from folks who have responded. So I'm going to ask you to go through these as you finish your thoughts on this topic.
Yeah, definitely. So several of the respondents voiced increased concerns for the health of their beneficiaries, which is something I was alluding to, that they need to provide, different levels of protection to their employees or volunteers that are still operating. And one of the responses that we received was an organization that provides shelter and food services. And their management decision was that, one, they need to continue their services because they are essential, but they also made this very difficult, I'm sure, decision to require that their staff stays in the shelter until the pandemic-related restrictions are lifted. So these employees or volunteers are actually staying and living in these shelters so that they're not bringing in external contaminants, and that they're able to continue providing these efforts to the community members that need them most, which I think is just a valiant and amazing thing that they're doing at their organization. And we received another kind of narrative response from an organization that says that works in the field of domestic abuse, and they're seeing an increased need for their services right now because victims that are spending more time in the home and spending more time with their children that are unable to attend school are spending more time with the perpetrators, and which puts them in greater danger essentially. And so at the same time, we're seeing the increased need for food banks for those that have lost their jobs, and increased need for things like domestic abuse services because they're spending more time in the home.
Jessie, I think this just really illuminates what charities around the world are facing, because what we're seeing here is that certainly those who are providing direct response to those who have COVID-19, we understand that, and that's extremely important and sort of ever present in our minds in the data that we see on a daily basis. But just sitting just under the surface are stories like this, where charities who need to keep their own staff members safe are also fearful of the services. The reason that they exist in the first place, and in many cases puts them at odds with keeping their own staff safe. Let's go to the next slide. This is a slide that is sharing with you in a lot of ways sort of the epicenter of what charities are facing right now: increased costs, lack of being able to travel, just what we were just talking about now, Jessie, the increased costs of providing service, the risk to their employees, canceled major events. They've had to stop recruiting. So those who are seeing, as you just mentioned, domestic services, are seeing increased need for their services. How do they recruit more staff to that? As we move past this slide, Jessie, I'm going to move past the slide and go to some comments here and ask you. This comes to us from a community-based organization providing services, and I think this sort of illuminates part of what we're talking about here. So I'll let you take this slide.
Yeah, definitely. So this slide shows another narrative response where a community-based organization providing services to the elderly is very concerned about transitioning their clients from participating actively in group therapy sessions to now being isolated at home. The transition to family members having to provide 24/7 care can have a huge impact on stress levels, which might jeopardize the safety and well-being of those elderly clients. I think another issue that we're seeing globally around something similar is that, that individuals that were in rehab for, alcoholism or different things like that, they're now, having more difficulty not being in spaces that they can be away from substances and prevent their substance abuse issues. So that's another similar issue that we're seeing due to this home isolation and not being able to go to these service providers. Another quote is, "Even though the vast majority of our day center staff is unable to perform their work at the center, they are making themselves available in emergency situations to support the family members that are acting as caregivers." So again, an amazing act from employees of these organizations that are trying to keep their services going in whatever function that they're in whatever way that they can. And so I think all of this, just to comment generally on how donors should be thinking about these types of responses that organizations are having, is that we're of course seeing a huge and amazing outpouring of support from donors that specifically are setting aside funding to support hospitals and medical institutions and everyone that's directly responding to COVID-19. But really, and that's wonderful and absolutely necessary. But I think another thing that funders need to think about are, is this long-term impact and in terms of the provision of general services that on an ongoing basis, and perhaps set aside some of their budget for funding organizations in the long term that are responding in different ways to this disaster that aren't specifically medically related. And that's, thinking about long-term support is always a challenge in disaster relief generally. This is something we have lots of donors that come out of the woodwork right when a disaster happens. And then there's sort of this long-term impact that we have more trouble getting sustained funding for. But it's really essential to get that need for long-term funding across with your donors if you're coming from the charities perspective, or to consider as a donor if you have grant funding yourselves that you're trying to set aside for this.
Jessie, we're going to go and move on to the next slide, which I think you would agree is one of the most powerful slides in this entire report that Kinga and her team have produced here. And in responding to this report, there are two questions that are over in the chat group that I want to bring forward as we start analyzing this information. One question is, how do charities reframe the ask to highlight areas impacted and shared in this research? This is impacting the donor sector on a global scale. We certainly understand that Krafft America is one of the premier global grant makers. And so we are hearing from our donors that they want to know these stories. They want to have this data so that they can understand, not just sort of the top level, which is extremely important in providing service to those who are directly affected by coronavirus and by COVID-19 disease. But what we're drawing forward in this report is what's next under that surface, and that social safety net for many communities that is very likely, and as you can see in this report, the fear here and the concern here is that they will be degraded over time, in some instances very, very quickly. But what we're seeing is just in a short period of time, a potential very steep decrease in the funding for a lot of charities. Jessie, we had another question is, what I continue to hear is that corporations are focused on existing NGO partners versus new partners, a challenge to navigate Insight Welcome. Well, Jessie, as you mentioned yesterday, we had a webinar where we had representatives from PepsiCo, Edwards Life Sciences Foundation, and Mars Wrigley Foundation. And to a person, they were talking about how they are focusing on their partners that they can trust and that they can reach out to. And part of that is the network that Krafft America provides. So to this person asking this question, what we heard from these folks and many other donors, and I'll have Jessie respond to this in a second, is that they are focused on partners like Krafft America, where we can surface potentially new charities that can meet the mission and meet the scope of funding that each of these donors is looking to support. And I really do think that research like this is going to help surface sort of that social safety net and what will be left of it after COVID-19. So Jessie, I'm going to send this back over to you.
Yeah, definitely. And I think another way to think about that, and another question we've been getting from donors is, that they have certain funding pillars and things, topic and issue areas that they're supposed to fund and that they've been approved to fund by their boards of directors or, by their leadership. And, I think there are ways that different organizations are starting to frame the need around COVID-19 that, this is quite literally hitting every part of all of our lives in different ways. And so there are ways to to still fund those pillars if you need to, and identify organizations that are responding within those pillars. And I think that's been a powerful conversation that we've been having with some of our donors is how to maintain the overall mission of their grant making, but also, can pull in COVID-19 specific relief.
Yeah, Jessie, another question that I think is a tough one to answer, but I do want to ask you if in the research here or in your direct interaction, there's a question: how do we manage the impact of not having volunteers available to assist and serve charities, which of course is very difficult, but there's a great story that I know, Jessie, I think you read in the research that came out where there is a homeless shelter that to stay open, this is, I think these people get added to the list of heroes. Their staff members are volunteering to live at the shelter with those that are in need to protect them from having to go out and potentially bring the virus back in. So talk to us a little bit about what you're hearing, because this is a real fear and of course a real problem across the planet.
Yes, absolutely. There are a lot of different activities, as what Ted has mentioned, to continue that, in an effort to continue the operations of each of these organizations in different ways. And I think, we're still such a, so young in what the coronavirus and the impact that it will bring to these. So I'm certain that more stories like that will come out of the woodworks, and that organizations right now are discussing plans for different creative ways they can keep their operations moving.
That's right. Jessie, there's also a question, and I appreciate this question being asked because we do have an announcement to make today. We're beginning to see reports that cities in the global south, Mumbai, Nairobi, and others could be just 6 weeks away from emerging as hot spots. Does CAF America plan to conduct another survey in the next 30 to 60 days to gather additional updated insights? Yes, in fact, we are. CAF America is committing to do this survey on a regular basis. We're working on the details right now, and we will post a press release on how often this will be done so that we can look at this data over a period of time. So, and we're not just going to do it in that 30 to 60 day period, but we're going to continue to do this survey, quite honestly, until it's potentially not needed, because as Jessie mentioned earlier, this is a moving target. This is the first report and survey of its kind. This is the first time that we're able to share with donors specific information about what's happening to the global social safety net. And I think that this is going to be very powerful to helping potentially broaden funding opportunities for donors around the planet. But you're absolutely right, the person asking this question, we want to come back and look at this data, and as it becomes more prevalent in other parts of the planet, as Jessie mentioned, some areas are thankfully not yet as affected as China, Spain, New York, but the fear is, and of course the data is showing, as is mentioned in this question, that areas like Mumbai and Nairobi are literally just weeks away. So we hope that this data can help charities in those areas plan ahead to use the time that you may not have as much of an effect of the virus in your communities. It is very unlikely that it's not coming your way. So what can you do to fortify your volunteers, to fortify information that you're sharing with your donors, so that as this comes forward, you can be prepared. But CAF America will continue to survey and will share updated information so that we can see over time how this COVID-19 global pandemic is affecting the nonprofit sector around the world. Jessie?
Yes, absolutely. I'd say, another consideration that, and something that we've seen specifically that we need to consider in this long-term impact and in a potential impact on revenue over the long term for charities, is that we're already starting to see some impacts on civil society and the freedom of expression generally with some of the government mandates that are coming through, which are, in many cases necessary, these government mandates, of course. But in some countries, it's creating spaces for authoritarianism and control of communications, which, as we know, from past work that we've done with restrictions on civil society spaces, it can obviously have a huge impact on activities of organizations and their ability to operate. For example, legal experts in Thailand have come out and said that some of the emergency actions that have been taken in the country serve to restrict actions unrelated to pandemic control, which will have long-term impacts on civil society itself and their ability to operate. I just want to call out a resource that is great and will really help us track all of this, is that the International Center of Nonprofit Law has a civic freedom tracker that they've developed, but they're using this to analyze government responses and track data on attempts to limit activities of civil society beyond what is necessary for pandemic control. So again, that's International Center of Nonprofit Law's Civic Freedom Tracker, which is something that we're paying attention to because it could impact our ability eventually to send foreign funding into certain countries.
Yeah, and Jessie, there's another question. Did any of the research in the survey measure the impact of reduction in funding from donors committing funding to government needs and calls for support? I think there's a mention of the Kelvin Glenn at Krafft Southern Africa. Everyone's opinion on cross-border giving in the current and future. Will this have a long-term effect on international funding for charities in developing countries? I think this will. I just had a conversation with Krafft Southern Africa just before this particular webinar, learning more about what's happening on the ground there with our partners at Krafft Southern Africa. You can count on additional direct information being shared with our funding community as Krafft Southern Africa begins solidifying some of the work that they're doing with major philanthropists in country, and how the United States and other countries can support Southern Africa as well as other countries around the world. Jessie, we're going to go to the next slide. Folks, we just have 2 more slides, and then we do want to get to any additional questions that you may have. Jessie, the respondents were asked if they were providing direct services to those affected by the coronavirus pandemic, and just a very large number, 43% of those that are responding to this survey. That's a very large number of direct respondents to this. And of course, that gives even more of a reason for us to make the commitment to all of you today. Krafft America will continue doing this survey. We will begin able to show a sort of a longitudinal view of what's happening as we try to do everything we can to bring donors and charities together to support not only the needs of those who are directly affected by the pandemic, but the ancillary deterioration of the social safety net around the world. So Jessie, do you want to give a quick highlight on this, and then we'll go to our last slide and get to questions?
Yeah, definitely. So I think we are, of course, seeing more needs pop up in different places from those who have lost jobs or that might lose their jobs or have been furloughed or different things around the world. And so I think this high response rate in terms of those that are providing direct assistance, goes towards the medical relief, but also goes towards supporting those who have been negatively impacted overall because of the required isolation and other economic effects of this crisis.
And of course, Jessie, we're hearing from so many charities that do fear that they won't survive the end of this pandemic, and we certainly want to do everything we can to keep that from happening. Let's go to our last slide here. Just very quickly, folks, we just want to share with you, as Jessie mentioned earlier, we had a podcast, or we had a webinar yesterday on corporate responses to COVID COVID-19 around the world. That will be posted at craftmerica.org so that you can listen to that podcast. This podcast and the supporting research survey will also be posted immediately after this and will be emailed to you at craftmerica.org. You will also find our list of COVID-19 response charities. There are 175 eligible organizations right now who are providing relief efforts, and that page is updated daily. Tomorrow, Krafft America will have a podcast on the new Coronavirus Relief Act, the CARES Act that was just signed into law last Friday. Within that law are brand new charitable giving rules in the United States. We're going to give an analysis of what those charitable giving rules are. On Friday, obviously, a lot of employees are being affected. A lot of hardship is being created. And so Krafft America will have a podcast that will be released on Friday on the law and employee emergency and hardship relief funds. We have other resources on granting on our website. We have our COVID-19 response page. And so let's go on to the next page, which is just to get to questions. Jessie, there is a question. Are we seeing charities form consortiums to have a greater impact on delivery of services and donor funding?
Yeah, that's a great question. And it's not one we've specifically seen yet, but I think that's a really important concept and should be something that charities are considering moving forward. Is not, everyone is learning as we go right now. And I think if related organizations in local contexts can help and support each other and learn from each other and everyone and the creative ideas that they're having through those groups, that would be incredibly important. I'm sure there's stories of where this is happening right now, but none have directly come to our attention as of yet.
There's another question here. Are we seeing charity, or are there any stories that are being uncovered of NGOs who have weathered the storm, possibly any information coming out of China? What strategies should NGOs be applying to get through this? Again, a lot of parts of the world are just now dealing with this or are right in the middle of this, and some of the stories that we are receiving certainly of a lot of creativity and a lot of heroism on the part of staff members of nonprofit organizations. Jessie, is there anything you can draw on specifically from China?
I think it's still a little bit early. Yes, I think China is mostly through the pandemic based on the data that's being released now, but I think it's still not quite, it hasn't passed long enough yet for us to know who has weathered the storm. We have continued making grants into China throughout this for COVID-19 related and unrelated purposes. So we know that, many of our charitable or, partners there are still in operation. But I think, time will tell on who will weather the storm as they get through it.
Terrific. There's also a question about sending a link to register. Tomorrow, April 2nd and April 3rd are not webinars. These are podcasts that we will be dropping, and then you can listen to those. So yes, everybody who is registered today will receive a link so that you can listen to our podcast on these two very important legal matters, IRS regulations, and how you can be and how donors can be in compliance with those. Jessie, we've got just 1 minute left, and I just wanted to ask, how do charities communicate this information to funders as a way to help them understand the broad effect of COVID-19?
Yeah, we're seeing that in a lot of ways. I don't know about you all, but I certainly have an increase in my inbox capacity right now in terms of all of the emails I'm getting from, all of the charity lists that I'm on, that, some of them have been really important and they're great resources for us to read through and to understand how they're responding and specifically how they're communicating their response to donors. So I'm sure you've all received some of those. So I do think while it can clog the inbox, it's an important method of communication and something you should at least try to skim for your partners that are trying to communicate with you in terms of what they're doing. We're actively outreaching to our organizations outside of this survey. Of course, this survey was active research on our part, but we're also reaching out to organizations individually in certain hotspots to ask them questions about how they're responding, so that we can inform that our site where we're listing all organizations that are responding, and to help each of our donors prepare their responses for certain countries. So, I think a combination of passive and active outreach on behalf of donors is important to help get those charity messages through.
Yeah, Jessie, I think that's really good advice for everybody. I think at this point, don't be afraid of over communicating, particularly since we are kept from having that face-to-face. Certainly there's video, but over communicate with your staff, with those that you provide service to, and certainly with your funders. On behalf of all of us here at Krafft America, our commitment to you is to continue to provide information. We will continue to survey the nonprofit sector. We will continue to bring corporate funders to our webinar so that you can learn what they are doing and what decisions that they are making in real time. So thank you all for joining us today. I think we covered all of the questions that were in the chat room today, but if we did not, here's our contact information, and you can email Jessie at her email address right here, or directly with me at any time. Thank you. That is our presentation for today.